Well, hey guys, in today's video, I'm going to be talking about this trend that's been going around for a while of icing your face or doing a ice facial. If you're new here, welcome. My name is Andrea. I'm a board certified dermatologist. I'd love it if you would subscribe to my YouTube channel and hit the thumbs up. It really helps my videos out a lot. Okay, so you guys have been asking me about this for a while, and it is this trend where you take a few ice cubes, wrap them up in like gauze or cotton, and massage them on your face, around the jawline, the neck, in like a circular fashion. And proponents of this, they claim that they do it sometimes multiple times a day, which seems time intensive to me. And they claim that it helps with skin complexion. They claim that it helps reduce oiliness and acne, helps reduce puffiness, especially puffiness around the eyes. They don't just use water ice cubes. They also try different things like tea in the hopes that the caffeine in the tea will have, further enhance the effects. A lot of people I've seen claim that doing this facial icing or ice facial helps increase penetration of skincare products and ingredients because ice is a vasoconstrictor, and they claim that it's gonna, by icing your face, somehow the vasoconstriction is gonna like suck your skincare products into your skin. Of all the cockamamie things that there are on the internet, this is kind of not so bad. Cool compresses, because they do in fact result in vasoconstriction, they can reduce inflammation and swelling, and it's a go-to recommendation for a variety of things, namely cystic acne. If somebody has a really painful acne cyst, acne is incredibly painful, and a lot of why it's painful is because there's inflammation there that brings in a lot of fluid, exudate, and there's not a lot of space in your skin for all that fluid to go, and so it accumulates there, and that feels tense and painful. A cool compress can definitely help that, and it also can help it, kind of heal faster just by reducing swelling. Swelling creates, kind of a barrier for the healing cells to come in, and by reducing swelling, you can kind of help expedite recovery of things like a painful acne cyst. A lot of people also deal with ingrown hairs that become painful, similar to acne, and a cool compress likewise can help with that. There are a variety of other cysts that aren't related to acne for which we recommend cool compresses, like an epidermoid cyst. I think I've talked about these in other videos before, but they're basically a little cyst that forms around the hair follicle and can become swollen. Sometimes it can rupture, and that can be very painful, and ideally it would be removed before that happens, but if it does happen, then a cool compress is what we're going to recommend because it's going to reduce that redness and irritation and reduce the inflammation in the skin. The vasoconstriction from the icing also, logic follows, it's going to help reduce puffiness, especially puffiness around the eyes. The skin there is pretty thin to begin with, so it's going to, feel the effects of that cooling temperature, and you're going to get vasoconstriction that may help push some of that fluid out of the tissues. If you're waking up though every day with puffiness around the eyes, definitely check out my video on puffy eyes. There are a variety of reasons why this might be, and you can save your ice by addressing possible causes. Oftentimes people maybe have too much salt in their diet, causes fluid retention that manifests around the eyes. There are a variety of possible reasons. Seasonal allergies, people tend to have a lot more swelling. Simply addressing your seasonal allergies with, an antihistamine or, allergy shots with your allergist, that might actually help you. But of course, if you suffer from allergies, you probably are, there's a good chance you're already doing those things, but you're still having allergy symptoms and you're still having itchy, watery eyes. So yeah, sure, this is something that definitely can help reduce the puffiness. As far as the claims about it reducing oiliness, I know a lot of you guys, who deal with oily skin, you're always asking me about things that can help reduce oiliness and shininess. I don't believe that the action of putting ice on your face actually changes the rate of oil production, but I can appreciate how there is some logic here, because anything that causes reduction in inflammation, which we already talked about happens with the cooling, the cool compress reduces inflammation. Anything that reduces inflammation has the potential to reduce oiliness if done consistently. Why? Well, inflammatory mediators in the skin, they do contribute to more oil production. So I guess that kind of makes some sense, but I'm telling you, it's not like there are any studies of facial icing to confirm this. If you deal with facial redness, you will appreciate some temporary improvement in the redness by doing this. However, you kind of need to address the reasons why you have facial redness. Is it because you're using products that are irritating? Is it something in your environment that is drying out your skin and making it more prone to redness? Like maybe you've been, somewhere where there's a heater, or even the air conditioning makes the air very dry, makes your skin more prone to losing water and redness. Or do you have that facial redness condition, rosacea, where you get flushing and blushing that comes and goes and over time can be more persistent? You will appreciate some benefit from facial icing. However, I actually tell people with rosacea, when they start feeling a flush come on, I don't tell them to put ice on their face, but I haven't told people a tip is to put a little ice under your tongue. It cools the core body temperature and kind of, addresses this issue of flushing. For example, a lot of people with redness prone skin and or rosacea, when they work out or get their heart rate up, they often experience a flare of the rosacea. So I tell people, maybe when you work out, have some have some ice nearby and put some chips of ice under your tongue. It can help. Speaking of flushing and blushing, I know many of you out there deal with symptoms of perimenopause, hot flashes. You probably already know, prior to the social media trend, chances are you were reaching for a cool compress. That definitely can help alleviate those symptoms. The other group of people who definitely benefit from employing a cool compress to a given area are those who deal with itch. Itch is up there with pain. If you deal with any form of acute or chronic pain, your heart has to go out to people with itch because they are in a similar category of suffering. Itch is a miserable sensation. If you've ever experienced chronic pruritus, chronic itch, it can make your life a living nightmare. If you've ever experienced chronic pruritus, aka chronic itch, it can make your life miserable. Some people, they develop some bug bites and then they get itchy and then they're constantly scratching and it develops into a real problem. And this actually can seep into your sleep cycle because you're scratching when you don't even realize it. In your sleep, you're not getting good quality sleep. And then poor sleep aggravates your stress, and that actually further fuels more itch. So I often will tell people, when you feel a sensation of itch, rather than scratch, which actually brings about more itch mediators, take maybe a cool compress and apply it there. It will silence those itch signals, some of those itch signals. Alternatively, I also tell people, especially people with eczema who deal with a lot of itch as part of their disease, I tell people, keep your moisturizer in the refrigerator and chilled, and apply moisturizer to the skin as soon as you feel itch and rub it in a circular fashion, as opposed to scratching. Taking chilled moisturizer and just massaging it into that itchy area, it'll help silence those itch signals, and it will also reduce water loss out of the skin that further would otherwise contribute to persistent itch. So therein, cool things are helpful. Itch is not exclusive though to bug bites and people with eczema. There are a variety of chronic diseases where you have persistent itch. And also a lot of people just develop non-specific facial itching, maybe sometimes related to stress and or anxiety, and it tends to be greatest in the evening, like when they're going to bed and they just kind of feel like their face is itchy. This action of the ice facial or facial icing, I can see how that actually could help those folks out a lot to reduce those itch signals that would drive you to scratch and be touching your face and keep you up, cause you a lot of stress. So that makes some sense for sure. I've seen some people talking about taking like green tea, freezing it, and doing like a green tea ice facial. There are beneficial compounds in green tea, EGCG namely. It's a catechin that can reduce the burden of oxidative stress in the skin, but whether or not, I would be very doubtful that its integrity is preserved with freezing and thawing. The action of freezing and thawing can compromise the stability of a lot of things, so I'm not so sold on that. Many people like to use aloe vera gel to a sunburn, and I have often told people that try putting some of the gel in ice cube trays, freezing it and applying it to a sunburn just for symptomatic relief. That's not gonna change healing necessarily of the sunburn or make it go away any faster, but it does provide some symptomatic relief of the discomfort from a sunburn. If you're working in the kitchen and you sustain a thermal burn from heat, first degree burn, right away actually put a cool compress on it. That will help a lot. Or run it under some cool water. That will help it heal better long term and reduce the extent of damage in the skin, that cool temperature. One other condition where I can definitely see people anecdotally noting some improvement is anything related to hyperpigmentation, especially melasma. And the reason I say this is because part of melasma, there is an underlying blood vessel component, a vascular component. Melasma is a condition that actually worsens not only because of ultraviolet radiation exposure driving hyperpigmentation, but it's also worsened by heat. And therefore, I can see how this aspect of, doing a ice rolling or facial icing may potentially reduce some of that vascular component just by the vasoconstriction. Overall, I find this relatively harmless. It's taking something basic, a cold compress, and, doing it all over multiple times a day. That seems a little bit, like I said, labor intensive, and you always can do too much of a good thing. And this seems like it has the potential to do that. While cold compresses definitely have their role in reducing inflammation, you also have to be aware of the fact that extremes of temperature to the skin are not good necessarily. What about the claim that facial icing improves penetration of skincare ingredients? That seems very suspicious, but if you do have swelling, that fluid in the tissue is going to act as a barrier to good penetration of ingredients into the skin. So I guess I can see that logic as well. But if you're coping with facial swelling, make sure that you are addressing the cause rather than just remedying it by doing this ice massage thing or facial icing on a daily basis. But yeah, I guess I can see that, but people don't have shouldn't have swelling and edema to the extent on a daily basis that their products are not getting into the skin properly. So this just seems a little bit unnecessary to me. And I don't, with anything, you can take something good and you can have too much of a good thing. Taking a cool compress and going overboard with it, doing it all over multiple times a day, there's still, there's the potential for problems. Skin doesn't really like extremes of temperature. I appreciate the fact that they wrap the ice up in gauze or cloth. In dermatology, we use very extremes of cold temperature to treat a variety of things. It's called cryosurgery or cryotherapy. In that case, we're using liquid nitrogen. You may have had this done at some point in your life if you've ever seen a dermatologist, or many family physicians also use cryotherapy in their practice. It's great for treating warts. The way it works is liquid nitrogen actually has a boiling point of minus 196 degrees Celsius. So it is super, super cold. And the way liquid nitrogen and cryotherapy works is we direct it to a given skin lesion that we're trying to eliminate. It works because it relies on the temperature difference between your skin and the liquid nitrogen. It's a pretty substantial gradient. So we're able to very quickly freeze a specific lesion or part of the skin. And it's the action of that freezing and then the subsequent thawing. And in some cases, we will freeze again, especially if we are treating it like a pre-skin cancer. And that action of freezing and thawing and freezing and thawing, it causes the skin cells to necrose. They can't handle it. And you get localized skin destruction of a given lesion, like a wart or a pre-skin cancer. We use it a lot and it's very safe, provided it's done correctly. Main side effects are, if not done properly and done too much, you can have scarring, you can have discoloration, especially in people with deeper skin tones. They actually can heal with hypopigmentation rather than hyperpigmentation because of the destruction to the pigment producing cells. But icing your face is definitely not that cold. It's not going to destroy your skin cells, but of course you can always do too much of a good thing. Prolonged contact with ice on the skin is not a good thing. So make sure you are keeping it wrapped up in cloth or gauze if you're going to do this, and you're not leaving it on the skin. Who should not do this? There are a few skin conditions that you would want to avoid this. They're rare, but they do exist, and maybe you're dealing with this yourself. There's something called cold urticaria. Urticaria is the medical term for hives, and some people develop cold urticaria where they get hives upon exposure to cold. So taking an ice cube and putting it on your skin, even if it's wrapped up, will cause a hive there. There's also a condition called cryoglobulin anemia, which is aggravated by cold temperatures. Certain autoimmune diseases, you would want to avoid cold temperatures. Very young children also probably should not do this, although if anybody is facial icing their baby, that is, that is new to me. But the reason I say this is children, very young children, babies and toddlers, they have, their fat is a little bit different and it's more vulnerable to damage from this icing thing. They can actually get something called cold paniculitis, basically inflammation in the fat in the skin. Commonly we refer to it as popsicle paniculitis because a lot of times it presents with a young child who's been eating a popsicle, and around the mouth they were having prolonged contact with that cold temperature from the popsicle, and it creates a nodule on within the skin, and it goes away after a few weeks. One thing that I've seen a lot that I think, initially I was like, oh God, another gimmicky tool, but I can see the role for it, are those ice rollers. It's basically some of them are like a roller that has like metal around it. You keep it in the fridge so that metal gets cold and you roll it over the face. So I can see the role for that, and if you've got itchy skin, you want to roll that over, I can see how that would help. Overall, I don't think skin icing is just necessarily harmful, although in rare situations it could be problematic. Comment below though on if you have done this ice facial thing or facial icing. I would love to know, but overall it's pretty safe, and just again, anything you can take to an extreme, and I think the idea of doing this multiple times a day, it's a little unnecessary and over the top, and you can have too much of a good thing. But comment below on if you guys have done this. Do you appreciate any benefit? Again, to reiterate, I do frequently tell people who are dealing with a lot of flushing and blushing to take some ice cubes and put them under the tongue. That can provide some symptomatic relief, and that way you don't necessarily have to be facial icing. But yeah. All right, guys, if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.